Hi, this is a very important video and you must listen to the end. Some of the mothers, especially who are going for a preterm delivery, that is delivery before 37 weeks, may hear their obstetrician or the doctor telling them that you need to have an injection, a steroid injection. Now, the mother becomes very apprehensive and she thinks, steroid, I've heard so many bad things about steroid. Why steroid injection in my pregnancy? Now, I will explain in details in this video about this steroid injection before delivery. If you like this video, please like it and please subscribe my channel to see these kind of videos on pregnancy. Very, very important awareness, things which you must know. Now, if you have a preterm delivery, there can be problem with the baby's lungs. The baby's lungs, the fetus lungs, starts developing from mid 30 weeks. Usually the development starts from 34, 35 weeks because of a chemical secreted in the baby's lungs, which is known as surfactant. Now, this surfactant starts being secreted from this mid 30 weeks and it peaks around 36, 37 weeks. This helps in development of the baby's lungs. So if you develop or if you deliver the baby before 34, 36 completed weeks, the chances are that the lungs of this baby is not that developed. In that case, the researchers, the studies have shown that if an injection of steroid given to the mother, then this can increase the surfactant production in the baby and can help the lung formation. This study was first done on the sheep, and they found the pregnant sheep which were given this injection, their babies were much more mature lungs wise. When I was in England in late 1990s, this study was going on, and finally they came to a conclusion that for preterm deliveries, any delivery before 36 weeks, steroid injection should be given to the mother, not only to prevent this complication of premature lungs, but also the other complication, fetal complication of prematurity, like an intestinal complication, necrotizing enterocolitis. Now, there are two types of steroids which are given in pregnancy. One is betamethasone or betamethasone. The common company name is betamethasone. It's not always available, betamethasone, so you can give any betamethasone of any company, or at the dexamethasone. The England, in the hospital I worked for 3 years, they used to use dexamethasone. But the researchers have seen that maybe betamethasone is a better choice of steroid. Only 2 injections to be given. In case of betamethasone, 24 hours apart, and in case of dexamethasone, it can be given 12 hours apart. Now, once you give this, then again, as I said, the complication of preterm babies are much less. In nowadays, the new guidelines are there that even if you have a cesarean section up to 37 plus 6 days, you're delivering a baby before 38 weeks, steroid is beneficial. Now, there is a reason for that. When the baby goes for a normal delivery, it's squeezed through the pelvic canal and the water inside the lungs usually gets squeezed out, and the lungs probably inflate much better than you'd go for a cesarean section when the baby is quickly taken out and this squeezing effect is not there. So this lung complication, which is also known as RDS or the respiratory distress syndrome in the baby, is much common in cesarean section deliveries. So for a cesarean section, the Royal College of London is advocating use of the steroid up to 37 plus 6 days. But usually after 37 weeks, I don't give it because the chance of this complication is much less, and RDS or the respiratory distress syndrome can even occur in term babies, though the percentage is much less. So if your doctor, the obstetrician, says that you need to take this steroid injection, then you must take it. And it's only 2 doses, which is sufficient. For example, the doctor is thinking that he or she may have to deliver you before 34 weeks. And if he or she gives an injection before 34 weeks, and then you continue the pregnancy and deliver a little later, that one course of 2 injections would be enough for you. You don't have to repeat. The researcher says that there is not necessary to repeat these injections later on. So this is a very important topic. If you like it, as I said, like it. And if you have any questions, shoot below. I will answer.